Welcome back to another episode of Future Culture. I'm your host, Juanito, and I'm with my co-host, Gerardo. How are you doing, my homie?
I'm doing good. I've had a good day. I actually ate gorditas for lunch today. Shout out to my mom for putting all that together.
Jonathan, a friend of the show, will be joining us as well for a special episode. Great to see you, Jonathan.
What's up, y'all? I'm doing good.
That's right, Juanito. We're recording on site here at the EV Dennis campus in Northeast Denver for the Denver Health Vaccination Clinic. Our school district, Denver Public Schools, has partnership with Denver Health to provide services in schools, including distributing the vaccine.
Oh, earlier this month, we learned some exciting news from the CDC that kids 5 and up can now get the COVID vaccine. This is great for our team because now we have extra protection against COVID.
Yeah, the only thing that hasn't been protecting us kids are masks. And let's be honest, some of us struggle to keep our masks on in school. I know I do.
Yeah, this is exciting, but it is important that we have the correct information because a lot of us are nervous about taking the vaccine. There is a lot of different information out there and it can be confusing. That's why we have invited Dr. Federico to the show.
Dr. Stephen Federico is a specialist in pediatrics and practices at Denver Health Clinic here in Montbello. In fact, he treats a lot of our students at our school.
What's funny that he's my doctor.
He's my doctor too. He's been my doctor since I was a baby.
We are grateful that Dr. Federico works in our community and is joining us today. Welcome, Doctor. How are you today?
Hi, Juanito. Thank you for having me. I'm excited to be part of the show.
Yeah, we're happy to have
Yeah,
you.
we're happy to
Yeah.
have you.
And thank you for being here with us. Welcome to Future Culture.
Dr. Federico, can you tell us a little bit more about yourself?
Sure, Jonathan. My name is Steve Federico, and I'm a pediatrician, so I take care of kids.
Yeah.
I grew up in Arizona on the border with Mexico in a town called Nogales. So I grew up speaking English and Spanish like a lot of you guys, both at home, eating gorditas like you, Gerardo. That was one of my favorites too. And I've lived in Denver for over 20 years. And I've been working for Denver Health for most of that time. I've been working out here in Montbello and taking care of kids like you.
Like we mentioned earlier, a lot of kids in Montbello know who you are. What motivated you to become a doctor?
Yeah, that's a good question. So I was the first one in my family to be born in the United States. My dad was born in Mexico, and he became a teacher. And so he
Oh.
always talked to us about how important it was to be good students and to do well and to go to college. And so I was excited to do something where I got to help people the same way that he did as a teacher. And so I decided I wanted to be a doctor, and I studied really hard and was lucky enough to fulfill my dream of being a doctor.
Did he teach you a little bit about like being a doctor?
No, he mostly taught me the value of hard work and family and
Yeah.
being part of my family and wanting to do good things and making my family proud.
Oh, and what is a day in life of a doctor like?
Yeah, that's a good question. Most of us spend most of our time in the clinic taking care of kids like you. And sometimes the kids come in just for their annual checkup to see how they're doing. And we talk about things about how to stay safe and how to stay healthy, how to eat healthy, how to wear your seatbelt in the car to make sure that's important, and brush your teeth. But then sometimes the kids come in when they're sick, right? Sometimes they have a cold. Sometimes they have asthma and they're not breathing well. Sometimes they're feeling sad or anxious. So we take care of kids with lots of different problems. And so it's very fun because every day is different. No 2 days are the same. Obviously, for the last year and a half, we've been doing a lot of work around COVID. And in particular, I have had the opportunity to work very closely with Denver Public Schools and do a lot of work with making our classroom safe and getting everybody back from remote learning back to in-person learning. And I don't know about you guys, but my kids, I have 3 kids who go to Denver Public Schools. They were pretty excited to be back in the classroom and not be at home anymore learning. What do you guys think?
I think that's
Yeah.
good.
Yeah,
Much
that's
better?
pretty good.
Also, could I connect to something? I
Yes.
actually have asthma, and I sometimes can't breathe when I don't have my inhaler.
Yeah, so
Yeah.
a lot of kids with asthma have a hard time breathing when they're sick or when they exercise. We actually worry about them a little bit more with COVID too. So we want to make sure that they take their medicine and come and see their doctor and hopefully get vaccinated. But we'll probably talk more about that later.
And Dr. Federico, why did you decide to work in the Montbello community?
Yeah, so I had the opportunity to move to the Montbello community as a pediatrician. I think it was 12 years ago, about the time you guys were born. We had a lot of families moving to Montbello. And at Denver Health, we try and grow our clinics where we have more families and more families want to come to our clinic. So at that time, we had a very tiny, tiny clinic, only like 3 doctors. And so we started to bring more doctors to Montbello because more and more families were moving here. They were building new schools and new houses. And so I got to come here and start taking care of the new families that were living in this part of town. And because I grew up speaking English and Spanish, a lot of the families were speaking Spanish. And so they liked having a doctor who spoke Spanish. And so I've gotten to be here that whole time.
Yeah, you're a really funny and nice doctor.
Yeah.
That's nice of you to say, Jonathan. I
Yeah.
appreciate it.
Now let's get to the reason why we are here. COVID. How has COVID impacted you personally and professionally?
Yeah. So, fortunately, I know a lot of people have had COVID because I'm a doctor, right? And so lots of families have come and they talk to me on the phone or they come to the clinic and we test them. And sometimes they get a positive test and they have to stay home and be careful. And sometimes they get really sick. And I've even had some patients have to go spend the night in the hospital because they got COVID. And what was really difficult is, like you guys, I had never been in a pandemic before. I'd read about them in school. I'd learned about pandemics, but we hadn't had one, fortunately, in a really long time. And so we had to learn a lot more about pandemics. We had to learn about COVID. So I had to read a lot of stuff about COVID as it was coming out. And then we would use that new information to try and make our community safe. One example of that is, what do you think? Wearing masks?
Yeah.
Yeah. At first, we didn't know about masks as being something that was super helpful. And as we learned, we try and encourage everybody to wear masks when they're inside. And especially when we came back to school, it was really important. Juanito, you mentioned how hard it is to wear a mask, but just how important that was so that we wouldn't have to miss school to do it. So it was really hard to learn all that information really fast and then to communicate it out to our families and our communities so that everybody knew as much about COVID as possible. Because one of the sad things about the pandemic is people have been getting their information from like the internet and different places where sometimes not all the information is true or correct. And so as a doctor, it was really important for us to try and send the messages that were accurate, and so that people could understand it and know that it was the true information. And that's been a lot of the work that we've been doing now, is trying to get all that good information out there so people could make decisions and help their families stay safe and healthy.
Also, it was really hard to like find masks like when the pandemic barely started. So yeah.
Did your families make their masks in the beginning?
Yeah.
Yeah, a lot of us spent time making our own masks, huh?
Yeah.
That was a strange time.
And you would
Now
have
there's masks everywhere though.
Yeah, and you would have to like wash it like every time because because my family didn't really like we looked everywhere to like try and find masks, but like we couldn't find any, so we just made homemade ones.
That was kind of cool though, huh?
Yeah, I helped my mom making one and I messed it up. So yeah.
And how has COVID impacted your life, Dr. Federico?
Well, it's impacted it because many of our families got sick. Some of our families had a hard time going to work. And so it was a scary time for a lot of our families. It was super stressful as a doctor because in the beginning, we didn't know if we were going to catch COVID from taking care of patients.
Yeah.
But, when you choose to be a doctor, you choose to be part of a community and you choose to protect that community. So we came to work every day and we were willing to take that risk to protect people like you. And fortunately, we learned pretty fast that things like masks and vaccines would protect everybody. And so now we've been working hard to make sure people have masks, like you said, Jonathan, and then also to try and get everybody vaccinated so that we don't have to worry as much when people go to work, so they could feel safe when they go to work and shopping and are out in the community.
And there's now a kid vaccine, which is pretty good for our team.
Way better.
Like I said earlier.
We could have some extra protection, like
Yeah.
you said earlier, Jonathan.
Yep.
So we've been lucky that we've had a vaccine for adults for about a year now, almost a year. And then the teenagers started getting vaccinated in May. So we spent most of the summer vaccinating teenagers. Matter of fact, in the United States, we vaccinated 7 million teenagers. And what we learned from that is just how safe the vaccine is.
Um,
Almost everybody did fine with the vaccine. They got a little sore. Sometimes they got a little fever, but they all of a sudden were protected and they stopped getting COVID as they got vaccinated. And now, starting last week, kids who are 5 to 11, so everybody who's 5 years old and older can now get the vaccine. And we're super excited to do that, like what we're doing here at the clinic tonight.
oh wait, so like did you help make the vaccine?
No,
Oh,
that was a different group of scientists.
oh,
But we did help some families who wanted to be part of the initial study when they were examining the vaccine. They were from here in Denver. And they were the first ones to get the vaccine when they were trying to decide how much they needed to give to kids. Because actually, we give kids a much smaller amount than we give teenagers and adults.
oh,
That's something we learned from the study.
and people like think because like you get sore and like you get fever, they think like something's wrong with the vaccine, but like
Yeah, that's a good point, Jonathan. In fact, when you get a little bit of a fever or you get sore from getting your vaccine, it's really just your body making a memory of what the virus looks like. So it's actually a good thing when you get a little bit sore or you don't feel good after you get the vaccine, because it actually means the vaccine is working. And one of the things I always tell families when they're afraid, oh, I might get fever, my body might hurt after I get the shot. I said, yeah, but it's only a little bit compared to if you actually got COVID. Right? If you get COVID, the effects are way worse and way scarier and much harder to control. What we see with the vaccine tends to be pretty minor and only like one day. And in fact, in younger kids, we're seeing even less of those effects too.
Do you have any tips for people that are gonna take the vaccine because I might take it today?
My number one advice to people about the vaccine is get it today, get it today, and get it today. So the faster you get it, the faster you're protected. I don't think that people need to be afraid of the vaccine anymore because we've given it to so many people, even so many teenagers, that we know it's really safe. And we see that once somebody's been vaccinated with both vaccines, their chances of getting COVID goes way down. It's not zero. It's not impossible. Some people still get it, but usually people that get it after getting vaccinated, they get a very mild case. They almost never have to go to the hospital. And that's why we think it's so important. And also, you then are less likely to give it to other people. So my advice is to get it as fast as you can.
And why do you think it's important for kids to get vaccinated?
yeah.
So the number one reason to get vaccinated is to protect yourself, right? Because if you
Yeah.
get vaccinated, you're less likely to get COVID. Now we know that kids don't get as sick as adults for the most part. Sometimes
Yeah.
some kids have to get hospitalized, but it's pretty rare. The second reason to get vaccinated is because you're less likely to give COVID to somebody else. So if you're not vaccinated and you get COVID and you're a kid, you might give it to somebody like your grandma or your tia or your teacher, and all those people might get sicker than you. Okay. And then the third reason to get vaccinated is to protect our community, to protect all of the people that we see when we're out shopping and running around and our friends. Because if we all get vaccinated and we're all protecting our community, then the pandemic will end faster and we could go back to the way things were before and have school without worrying about COVID in the way that we have to worry about now.
And yeah, there's a new virus, right? The Delta virus or something like that.
So though, it's a good question, Jonathan. So the Delta virus is actually COVID virus. It's
Oh.
coronavirus.
Oh.
Okay. It's the same thing. But
Yeah.
what happens with viruses is that they change. They change because the virus actually wants to reproduce, right? It wants to make itself over and over and over again.
Yeah.
And so viruses actually learn how to do that while they're inside your body, and they change in a way that allows them to reproduce more often. And so what happened with Delta is that the virus changed in a way that made it easier to infect us. So it made it easier for you to give it to Juanito and to give it to Gerardo. And that's what Delta virus is. It's actually coronavirus who changed itself in a way that made it easier to infect each other. And that's why people, even when they're vaccinated, have a small risk of getting COVID because the Delta virus is so infectious. But if we all got vaccinated, then the Delta variant wouldn't have as easy a time and it would start to go away.
Was it difficult to get the vaccine?
No, in the beginning, it was difficult because there wasn't that much vaccine. So if you remember last year, first they gave it to doctors and to policemen and firemen, people that had to be around people all the time. And then we gave it to older people because they were the ones who were getting the sickest. And then we started to give it to teachers. That was super fun, by the way, when we got to give it to teachers because they would come in and they were crying because they were so excited. And you know why they were so excited to get it?
Because they could like take care of like the kids.
Because they got to get back. That means they were getting closer to getting back into the classroom.
Oh
And they were so sad because teaching online was much harder and they missed you guys. And I had so many stories of teachers coming in, so excited to get vaccinated so we could get back to school. And now they're starting to get their booster shots because after about 6 months of the vaccine, we noticed that your body starts to forget it had the vaccine a little bit. So you need to get a booster shot to remind your body about how to fight coronavirus.
Oh.
So that's what we're doing now with the teachers. But it was so excited to do that back in March. And now we have it for kids. And now we have lots of vaccine.
Yeah.
So now it's super easy. There's lots of appointments like the ones we're doing here at the schools this week to make it super easy for our families so they don't have to go very far away.
They're actually giving the vaccine like I think like over there.
Like 20 feet away.
Yeah.
I have a question. Do you think, how do you say? I forgot my question. Never mind. I forgot my question.
Oh, why do you think people are nervous about taking the vaccine?
Well, I was going to ask you guys that question.
Oh.
Why do you think? What have you heard from your friends and families about why they maybe wait a little bit to get the vaccine?
I mean,
supposedly is magnetic, but obviously
I've heard people that like it'll like they think that it's gonna turn them. Well, not I didn't hear this from my family or anything, but I hear this from people on news and stuff that they say that it's gonna turn us into zombies and stuff like that. Which I think it's a lie because, and people say that COVID is fake, which I don't think is fake because if they've seen more than million people dying and they still think it's fake.
And they think that the government made COVID, which
Yeah.
is low key.
Yeah,
That's
lucky, kind of stupid.
What do you think, Gerardo? What have you heard? Some of those
I've
things
heard,
too?
I've heard that, and also people saying that like they're just giving you COVID in a shot for like you could get sick, and then you would need to pay a lot of money to the government and stuff.
Yeah.
and don't like they inject some of like the the virus for it to like fight it off.
Yeah. So let's talk about what the vaccine is. That's a good
Yeah.
question, Jonathan. And then I'm going to address some of the things that you guys talked about because they're kind of like myths, right? They're kind of like legends that people have spread. So the vaccine, this vaccine is actually not a piece of the virus. Okay. They actually take a piece of have you guys learned about RNA and DNA? Have you learned about DNA
Oh
yet?
yeah.
So they actually take part of what makes up the cells inside of the COVID virus and they take it out and they put it in a blender and they mix it all up. And then they take that piece and they put that into the solution that goes into your body. That's why you don't get COVID virus when you get it because it's not the actual virus. It's like a little tiny piece of the inside of the cell. And so it tells your body, hey, when you see this piece of a cell that looks like this, that's bad. That's COVID virus. You should fight it. And so your body makes a memory in its immune system, something called antibodies. That's like the army of the body. And so when the next time, if you were to get infected, your body would see that and say, oh yeah, that's that thing I'm supposed to fight against. And then it attacks it. And so then you either don't get it at all or you get a very mild case because your body has already built an army to fight against it. But because it's not the whole virus, you don't actually get sick in the way that you did with COVID. So that's something we learned, and that's how we make vaccines better than we used to 50 years ago when we first started doing vaccines, in using entire viruses. So we've learned a lot about how to make the vaccine safer. And COVID vaccine is super safe because we've learned all that information. Some of the things you were talking about, I've heard some of those same crazy stories, like turning into a zombie, right? Like, first of all, zombies aren't even real, right? So
Yep.
how can you turn into a zombie, right?
Mhm.
And if we we're going to want to make people sick, you think doctors would be the ones taking care of people and giving vaccines when our job is to take care of people when they're sick and not make them sick?
Mhm.
Yeah, so that's kind of frustrating to hear, right? When people say things that
Yeah.
aren't true.
Yeah, that's
But it happens
true.
all the time, right?
Yeah.
So the best
Yeah.
way I think to deal with that is to come out and talk about science and talk about facts and what we really know. What I always tell people is, listen, if you want to learn more about COVID virus, and come and talk to us at the clinic, come talk to a doctor. Don't go to the internet, because all kinds of people put stuff up there
Yeah,
and you
they
don't know what's
think
real, right?
you just gotta be awake. You know, you just gotta like not believe the stuff that people tell you because sometimes they're not like true.
Right.
What will it take for us to get to the point where we don't need to wear masks?
It's a great question, Gerardo. So we
Yeah,
need two things to happen. The first thing that needs to happen, what do you think I'm going to say?
everyone gets
Everyone that gets
We need
vaccinated.
almost everybody to get vaccinated.
Um,
Okay. So I'm going to tell you, in Denver, 80% of teenagers already got vaccinated.
oh,
So teenagers, shout out, right?
so
Shout
we're
out to
doing
the
pretty good,
teenagers.
right?
So we're doing pretty good. Now, 5 to 11-year-olds, they're next. We're only starting. But when we get to like 80 or 90% of all of the students in DPS, that's the first thing that has to happen. But it can do it. We can do it. Like, the teenagers already did it. So if you're a teenager out there listening and you haven't been vaccinated yet, get with the program, right? What would you guys say to them?
Wait. So like, what is it like? Was like one state only not wear masks, and then like while the other states are like doing better, do like
So
so
that's a good question, Jonathan. So the first thing is, we need lots of people to get vaccinated in our state, okay, and in our community in Denver.
yeah.
And then the second thing that has to happen is we have to have low rates of COVID. And
Oh,
obviously, if everybody gets vaccinated, probably the rates of COVID are going to go way down, right? Like right now, we have a lot of COVID in Denver, unfortunately, right? So
yeah,
we need that rate to go way down,
yeah,
kind of like where it was maybe in the summertime when there wasn't so much
yeah,
COVID, huh?
Yeah.
So lots of vaccine in our community, lots of people getting the vaccine, and then we need very little COVID, and then we can talk about maybe not having to wear masks all the time.
yeah.
Yeah.
And do you have any questions for our team?
I do have questions for you and your team.
Yeah, we see you got a paper full of
I got a paper full of questions.
yeah.
I'm prepared,
yeah.
because I was a little scared. I was a little intimidated of coming to talk to you guys, because I heard you guys were really smart. And if I wasn't prepared, you might make fun of me.
No,
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 okay,
no,
okay,
No.
no,
okay,
no.
good. So, do you know anybody in your family that got vaccinated?
I know I know my two sisters got vaccinated.
Yeah,
I know
Um,
that my brother, my mom, and my dad got vaccinated.
yeah.
My
And do they feel safer now that they're vaccinated?
Yeah.
my mom and my auntie got vaccinated, but my brother's like heck no. So
We need
I
to talk to
try.
your brother, huh?
I told my brother that nothing's gonna happen. Like it's just gonna be like a normal vaccine.
Well, maybe you can set an example, because one of the things that I've seen is, when one of the brothers and sisters get vaccinated, the other ones feel more brave. They feel a little safer. I've even see
Yeah.
that where sometimes the student wants to get vaccinated, and then the parents get vaccinated with them, because a lot of times we want to get vaccinated all together. And so now we can do it as a family.
Yeah. Do you have any more questions for
I do
us?
have another question.
Yeah.
What do you think I can do as a doctor to send a better message to make sure people will get vaccinated?
To like tell people that like it's not gonna be bad. You could like maybe like test it on someone, and
Yeah.
then like tell them like look, that guy is doing good. He hasn't gotten the vaccine because I've heard people be like um your heart's gonna deflate or something like that. That's just weird.
Or you could show them a video of like a younger person, like a little kid, getting their vaccine for that.
Yeah.
Encourages them to
Yeah.
do it.
Oh,
So if they saw somebody getting vaccinated, or if they knew somebody who got
Yeah, that way they
vaccinated,
Yeah.
can be like, oh, hey, look at this kid. He's getting vaccinated, and he's nothing's happening to
yeah.
him. So
Yeah.
so when you
And
guys get your vaccine, are you guys going to show it off? Are you going to show
yeah,
pictures
I'm
of
gonna
just
be
Yeah.
like,
hey,
look at that.
My
Like the
arm's probably
country.
gonna. I'm finally gonna be buff because my arm always inflates when I get a
yeah,
vaccine.
And
we're not
you
seeing
know
too
that
much of that, but
I don't know if it's a girl or a man that like goes like that with the coat with the bandage
yeah.
and that's gonna be me but man version. So yeah.
Oh, the one with the bandana like right here in the head.
No,
No.
no, the construction helmet.
Oh, that one.
Yeah.
oh,
Okay.
and it's a girl showing off her muscle.
Yeah.
Yeah. All
Okay.
right.
What else do you think we should do in our schools to encourage people to get vaccinated so that we can
Um,
move to a space where school looks more normal
I
again?
think I'd say like, hey, get vaccinated. That way, if cause like I'm gonna be honest, I hate wearing my mask in school, but I have to cause it's for our own safe.
Yeah.
So I
Yeah.
tell other people like, hey, put on your mask if anything, cause like if you get sick, then people start getting scared that they're
Yeah.
like,
And then they'll
oh,
make the.
cause
So do you think if we told people that if more and more people got vaccinated, we might be able to stop wearing masks? That would
Yeah,
motivate
that
people.
would. Oh, also, the teachers like tell kids to like put on their masks and like they get mad.
Yeah.
Like they get
Then
really
and
mad.
then
yeah.
sometimes they take away the recess. Like that's what they do in
But
my
like it's
class.
only for their safety and they think it's like
Yeah.
for something else, you
Yeah.
know.
Oh yeah, for our school we have this new rule because nobody's listening to
Like
keep
nobody
their
likes
mask
to
on,
wear.
Yeah.
and we did this new rule where the teacher tells us if she sees us with the mask off with 2 and 2 warnings, we're gonna miss recess. And I
And
think it's a
call
fair
home.
rule. I
And
think
I'll
it's a
call
fair
home
rule
too, yeah.
because that way they can be like, oh, that way the teacher can think that they're like, oh no, I don't want to miss my recess, so I'm gonna just leave it on.
Yeah,
And
and then like
kids get mad over it. I'll be honest. I sometimes get mad because I don't. I mean, it's fair, but I just get mad because like I missed my recess and I was thinking to play with my friends and
yeah,
stuff.
but like we also gotta focus like on our safety and yeah, so do you have any more questions?
Do you think it would be helpful if we started going to schools with as doctors and nurses and talking to the kids, or do
Yeah.
you think we
Yeah.
have to figure out a way
Yeah,
to
I
talk
because
would
to the
I
families
would
too?
want you to come to our class. You're the best.
Well, that's what we're doing right now, right?
No, but like in front of
Like,
our classroom, what if like
yeah.
none of us what if none of our classmates join?
Yeah, the live.
Yeah, so
Like we're
maybe
doing it.
some people would join.
Maybe so.
Do you think we should require the vaccine in the future, either to go to school or to play sports or to do things like that?
Yeah.
Yeah.
Why don't when kids in high school want to get into like football teams and stuff, they have to get vaccinated.
And they tackle each other. So like if they
Yeah.
don't like get vaccinated, then like you know how like they tackle each other and all that, like
Their
the
germs
virus
can go
could
onto
yeah
them.
germs yeah
So I know some teams that because one or two kids got infected because they weren't vaccinated, then the whole team had to be in quarantine and then they had to miss games. So you would think they want to get it just to be able to protect their team and protect their
Yeah.
games, right?
Yeah.
But you think we should maybe make it mandatory for them to participate?
Yes.
I have hand sanitizer right here.
Those are all the questions I had for you guys. Did you
Uh,
have any more questions for me?
no,
I mean
Thank you for listening to
Uh,
Future Culture
on the Voice of Montbello podcast, we are
So
thankful for Dr. Federico,
Federico,
Denver Health, and Denver Public Schools for making this possible. Don't forget to like and subscribe on all social media platforms, and we will see you on the next time.
Future
bye.
Culture out.
Someone's calling my phone. I'll be back. Oh.